First one's from Anna. The question is, what can be done to reduce the stigma around men seeking help when men often do not tend to enroll in something simple as an introduction to mental health support workshops?
I think there's a bigger community piece around how we talk about help seeking. And how we talk about. So we've obviously got that bigger picture thing, which is I don't think what you're asking. You're talking about the breaking down of barriers to get men into those kinds of services. I think it can be really helpful to draw on some of the strengths and some of the skills to draw them in. So what is it that they align with that's not going to be initially challenging to that, if it is toxic masculinity that's keeping them from help seeking? So it could be, you're already doing this well, how could we, support you further? Seeing other men doing it, so having role models that they can see, kind of enrolling, or spokespeople that are sort of promoting it, even down to the materials, so how do you advertise particular programs? Do you have pictures of men? It's not always possible, and this is a really interesting distinction. Sometimes men feel more comfortable to seek help from a female counsellor because they can feel more vulnerable. I have had worked with clients who specifically wanted to work with me over a male counsellor because of that construct of, well, I can't talk to a male about having big feelings because that's not masculine. So it could even be, potentially choice, or seeing how they interact with male versus female counsellors, potentially having both, or support workers or whoever staffs particular programs, and talking about sort of non-challenging. It's really hard because it's not like you want to like wash over it, and that you're not sort of talking about what you'll be supporting them with, but trying to have a look at what are some of their strengths that you can already tap into, so it's not as jarring in terms of help seeking. Talking about maybe practical outcomes, because that might be more appealing than talking about some of the emotional outcomes. You might talk about some of the behaviors or things that you might see, and tapping into, as I said, some of those positive masculine norms and advertising those, or really sort of making those well pronounced.
Yeah, and I mean, as with any marketing, you have to first understand what people think of your product as well. So in this instance, trying to tap into the understanding of what your target market actually thinks of therapy. The way they think about therapy is not at all what therapy is about. So you then adjust that language to something that they understand and can associate with. And I'm going to drop a link here. You can also, obviously use existing resources, or you don't have to reinvent the wheel. Movember has a really good website called conversations.movember.com, and the link I dropped on the session, on the chat, that will be on the session notes as well. It's got a few videos, and it's basically therapy for men, and demystify what therapy is, but the content is all designed to engage men. So you can definitely use that link as an information tool to people as you're creating resources.
That just prompted something in me as well, is when you find out what that particular population you're targeting understands about mental health, or how they construe mental health within the lens of masculinity, you can then sort of target the response. So I've worked with refugee and humanitarian groups. Males and their constructs of mental health are quite different from my own. So it was finding out, so for them they talked more about physical sensations. So instead of talking about, I've got anxiety, or I'm having panic attacks, or I've got PTSD, they would talk to me about physical symptoms. And I was like, yes, those are things that we can absolutely support and work with in this, so we can find ways that you're not breathless and your heart's not beating a million miles an hour. And that was able to draw them in and find that kind of common ground. So yeah, that was a really good, thanks for that prompt, Pedro.